Hi, my name is Tiffany Johnson, and today I will be discussing how to check your blood sugar and why checking your blood sugar is important. If you're a diabetic, checking your blood sugar is very important. Just a handful of these little candies can make your blood sugar go sky high if you're diabetic. 7.8% of the population are diagnosed with diabetes. Diabetes was the 7th leading cause of death on death certificates in the United States in 2006. Glucose is the main sugar that the body makes from food and cannot be used without insulin. Insulin is a hormone that is needed to convert sugars, starches, and other food into energy that is needed in your daily life. There are 3 types of diabetes. Prediabetes is the first kind. You develop this before you get type 2 diabetes. It's when your blood sugar is on the high level, but it's not high enough to be diabetes yet. 57 million people in the United States have prediabetes. Recent research has shown that long-term effects on your heart and circulatory system happen while you have prediabetes. Next is type 1 diabetes. Only 5 to 10% of people with diabetes have type 1. Mostly diagnosed in children and young adults. It is when the body does not produce enough insulin. Type 2 diabetes is the most common form of diabetes. High-risk people are African Americans, Latinos, Native Hawaiians, other people that live in the Pacific Islands, Asian Americans, and the older people. In type 2 diabetes, either your body does not produce insulin or your cells do not read the insulin. Some of the symptoms of type 1 diabetes are that you urinate more frequently, you are very thirsty, you may have extreme hunger, unusual weight loss, extreme fatigue, or irritability. With type 2 diabetes, you could have any of the symptoms listed under type 1. Also, frequent infections, blurred vision, numbness in your hands and feet, or cuts and bruises that heal slowly. And a lot of times people with type 2 diabetes don't even have any symptoms at all before they're diagnosed. Checking your blood sugar is very important because when glucose builds up in the blood instead of going into the cells, it can lead to diabetes complications. Some of those complications are heart disease and stroke, high blood pressure, blindness, kidney disease, nervous system disease such as neuropathy, or sometimes it can even lead to amputation when blood can't flow to your hands and feet. Checking your blood sugar is very easy. Some of the things you'll need is a blood glucose meter, test strips, lancets, which are the needles that you use to prick your fingers. You can buy the meters at any drugstore. They range from $10 to $100. They can do many things. Some of them make it easier to do by being able to put more test strips in at one time, or allowing you to connect to the computer to record your results. Just choose the one that you think is right for you. And if you have questions, talk to the pharmacist and they should be able to help you. Checking your blood sugar is very fast, and it just takes a few minutes. Once you get used to it, it'll be even quicker. And now I'm going to invite Sybil Brooks to come up and help me demonstrate how to check your blood sugar. She has been a diabetic for 20 years and has to check her blood sugar 3 to 4 times a day. This is the poker. You unscrew it. Your needle goes right in here. There's a little thing you twist off so that you can know that the needle hasn't been used before. You just stick it down in there and twist the lid back on. And then usually you pull them and it'll set it to be ready to poke you. Then your test strips should be in a container like this to protect them from damage. You just take the test strip, and this is the meter. You stick it in the meter and wait for the meter to tell you that it's ready for the blood. So this is, and you can hold it against the table so it doesn't, and you don't jerk back if you're scared of needles. So I'm going to let her poke her own finger. And you just massage the blood out and get just a little drop of blood. And then you just barely touch the blood to the strip and try not to touch your finger to the strip. Then it'll count down and give you your results. Right here in this box right here, it'll give you your results. Thank you, Sybil, for helping me with this demonstration. I have one question for you. When you test your finger, does it hurt?
No, not a bit.
Good. When you prick your fingers, the tips of your fingers have more nerve endings, so for it to hurt less, you can prick it on the side so the tips of your fingers don't get sore. Your blood sugar should be between 70 and 130 before food and lower than 180 after you eat. If your blood sugar is too high, you should call your doctor and get instructions from them on what to do. And if it's too low, you should eat things like crackers, like peanut butter crackers, or orange juice to raise your blood sugar. You need to make sure you wash your hands before you test your blood sugar and dry them well so that it'll be clean. And you can also use alcohol wipes to wipe it off. Some of the questions that some people ask are, once you put the blood on the test strip, sometimes the meter does not read the blood. Some people want to know if they can just stick more of the blood that's on their finger on the meter, but you can't do that. You have to put a brand new strip into the meter and prick your finger again to get a reading. Once you get your results on what your blood sugar is, you should record it in some kind of log. This is Sybil's log. She records 3 times a day, every time she checks her sugar, and she just lists them. And this allows her to be able to look and see when her blood sugar was really high or really low, and she can figure out what types of things she did that day to make it higher, or why it might have got low. Like if she ate a lot of sweets, it might have been higher, or if she didn't eat till after 1 o'clock that day, it may be lower. You should also take this record to your doctor so they can see how your blood sugar is doing, and they will be able to prescribe medications and monitor it so that hopefully none of the bad complications will occur. So as you can see, testing your blood sugar is very easy. I think the worst part of it is having to prick your finger. Other than that, it just takes a few minutes and you're done. It's very worth it if you have diabetes so that you don't develop these complications. Thank you for listening.